Meantime, consultant physician of infectious diseases at the Princess Margaret Hospital, Dr. Nikkeah Forbes, is in studio with us to speak to the transmission of the virus and some key concerns. Joining her is our Crystal Darling. Crystal?
Thank you, Nikkeah. Good morning, Dr. Forbes, and welcome to the morning edition. So could you tell us about some things that people need to keep in mind, key things that they need to keep in mind so that the virus is not transmitted?
Thank you, Crystal. Thank you for asking me to be here. This is very important information right now, and I cannot stress enough the importance of prevention. Prevention is very important because the general public, everyone plays a role in preventing this virus from spreading. That means doing simple things. They sound very simple, but they're very important. Hand washing. Keep your hands clean. Wash them properly with soap and water or alcohol-based hand sanitizer. If you're washing with soap and water, 20 seconds is how long you have to wash for. Also, do not touch your face. From what we understand, if you contact the virus on surfaces and put it near your mouth or nose or eyes, that is going to be the root of infection. Also, regular sanitation and hand and hygiene, keeping surfaces clean. And then if you're sick, cough hygiene gets very important. Remember, the symptoms are a lot like cold and flu, and it would be hard to tell the difference. So if you are feeling sick with cough, sore throat, fever, cough into a tissue, put it in the bin, wash your hands. If you don't have a tissue, don't cough into your hands. Cough into your sleeve. Also, try and keep away from people who are well. That means what we call social distancing. I know that that's a term that sounds really, really theoretical, but what it means is keeping your distance between yourself and other persons. We know that this virus spreads within about 3 to 6 feet. And so if you can keep within just about an arm's length or more, my distance from you, that's good social distancing. So if you come in contact with someone who is ill, those droplets won't land on your face or you won't be able to breathe them in. This gets very, very important right now. And really, what do you do if you're feeling sick?
Okay, and with that being said, we know that this has inspired a lot of cultural changes, and we see a new trend with many people wearing a lot of masks and gloves out in public. Do masks and gloves actually help to stave off the disease?
No, they're actually going to make you more at risk for infection. Please remember, gloves, you're not going to wash your hands as much. You could have them on for long periods of time. You're going to be touching things that are dirty. You're more likely to then touch yourself. Also, the masks, if you are well, they're going to be on your face. They won't work. Air can still leak around them. They get soiled. They change position. So that means that you then try to reposition it. You're touching your face and putting yourself more at risks. They're not for people who are well. Please don't use them. They're going to put you more at risk for getting ill. Not only that, they are actually needed. The masks are needed for sick people who are coughing to cover their cough and reduce droplets. And gloves and masks are part of the important things that healthcare providers use and rely on to keep us safe when we need to take care of you. If you come into hospital with something infectious, and using them on an everyday basis will not only not keep you safe, it's going to cause a problem when providers are trying to take care of persons who are ill, and it will cause a depletion and low stock. I am asking everyone to stop doing it in the general public.
Okay, and on that same note, there are many fairs, and people do things like that out of fairs. What can you say that can alleviate a lot of these fears that the public has about the disease?
So whenever you have a new infection, it always causes fear, alarm, anxiety, irrational behavior. But that will not help to prevent the spread. So what we really need to do is remember the facts. We can talk more about that. And what we should be doing is instead being concerned, learning the facts, planning, preparing, studying, and implementing responsible behavior and action so that we can curb the spread of this virus. That's what we need to be doing right now.
Okay, and we know that schools are closed as well, so there are many kids at home. Some parents, they go to work, they still have kids at home. What can parents do at home to enforce these measures to make sure that their children practice good hygiene while they're home?
That's a very good question. So small kids, they may not be able to spontaneously go to the tap and wash their hands. You have to keep their hands clean for them. You must encourage their caregiver or you to wash their hands frequently. It's going to be impossible to tell a small child not to touch their face. So this is exactly why schools are closed, so that we can do social distancing and preventing gathering of children. We want you to keep your children at home. We want you to try and keep them well. This includes some practical advice for parents. I'm a parent myself. My daughter is a little bit bigger, but you wouldn't have a play date with 10 families at this time. Keep in mind that if you have a play date, you're sharing the children having fun, but you're also sharing infections. Probably don't take them to a playground with a lot of equipment and toys, because those things really can't get sanitized. If they need to go outside, and they will, go to open spaces, use parks and outside places where the children can enjoy themselves. And really, you would need to try and limit their interactions and keep them in the home.
Okay.
Right.
And we know that shelves in pharmacies are depleting. Okay, there are many people just going and buying everything. And we know obviously we can't take everything together, especially prescriptions and those cough medicines that you see on the shelf. So could you tell us what are the main basic vitamins and the vitamins and cough serums that people would need to buy from the pharmacy?
Absolutely. So panic buying and stock up buying is not going to help right now. So what do you need when you go to the pharmacy? Essentially, you're going to need some things that you use to treat cold and flu over the counter. If we get to a situation where we have more cases and more local transmission of infection, people might start to have some cold and flu-like symptoms. And so things like Panadols are going to be helpful for relieving flu-like symptoms. I would recommend Panadol and not other non-steroidal anti-inflammatories like Advil and ibuprofen at this time. We're getting some information from Frontline on the field that this may make things a little bit worse. Also cough syrups and things that you would usually do for comfort care if you had a cold or flu. So sore throat drops, and then generally you're going to stay hydrated, and multivitamins are a good idea to overall boost immunity.
And on that same note, I want to touch on Busch Medicines. Many people are talking about, incorporating Busch Medicines during this time as well. Could you touch on that a little too?
So traditional doctors are not really trained in Busch Medicines, but what I will tell you is that at this time we're combating a new infection. There is no textbook you could go to say, okay, I know that this drug, that drug is going to work. So I would say that we have to use reason. And I think that people are sharing information from the front line about what theoretically can work. But keep in mind that if you use something that's non-traditional, if you combine it with other things, it could really be harmful. It could have side effects. Some things can have side effects. And I really couldn't guarantee to you that that would work, and I couldn't recommend that you use anything like a Busch medicine at this time.
Okay, and also coming up with a lot of these new trends are conspiracies. There are a lot of conspiracies surrounding COVID-19, and one of the more popular ones are, doctors and pharmaceuticals are trying to stay in business. But what are the actual things that doctors are doing?
Okay, so I've heard a lot of conspiracy theories. So let me say that this virus, we know that it is an animal-to-person virus, something called a zoonosis. We don't know exactly which animals are involved, whether it's one or a group of animals, and then the virus came to humans. Doctors are doing plenty. We're working on the front line to treat patients with infection. We're working across all of our specialties to get the facts out there so the public can know what they can do to stay well and to help us, because if you don't adhere, we're going to see more patients than we can treat in the hospital. And on other levels, there are doctors and public health that are public health experts that are looking at modeling and what we need to do in hospitals and facilities as a community, as a country, so that we can stem this tide of COVID-19. And we're doing plenty. I would say from my role at the Ministry of Health, I know that we are working in all of our teams together as a team to make the best strategy for combating this, and also across other government ministries. So I reassure everyone that we are doing the best that we can at this time, but there's something you have to do. We are staying at work for you. You do something. You stay home for us. Please, I'm asking you.
Okay,
Keep your social distance.
Thank you so much, Dr. Forbes. Back to you, Nikkeah.